So I'm not able to be with you guys tonight, but instead of being there and presenting like our science fair, I decided to show it to you guys through a movie. So I wanted to talk to you a little bit about my idea for the leadership project, and I was going to do the My Storyboard. So the idea behind this My Storyboard is it's to be used in the intensive care unit at a hospital. And I had talked to the charge nurse at City of Hope and scheduled a few meetings, but they were all canceled. So I'm just going to tell you kind of the idea behind it. I wasn't able to actually meet with Jesse, but I just proposed to him a few ideas about the My Storyboard, and I kind of want to tell you a little bit about how it's worked in the past and go on to how it could help facilitate a more holistic approach of nursing and better the patient. So while working on the intensive care unit this semester at St. Joe's, one of the things that I really admired about their unit was the patient care that they had, just the connection that they had with each of their patients and their families, and the effort that they really put towards developing those relationships. And so I thought that this would be a good implementation to City of Hope, because one of their key phrases is providing warm, personalized care. And at City of Hope, I know that they aim for this in everything that they do, because I want to work there, and that is one of the reasons that I love them. So in this presentation, I'm going to tell you about the My Storyboard, what it is, where it's used, and why it's important. So the My Storyboard basically is a poster that is hung in the patient's room. When I worked at St. Joe's this past semester, we saw these almost in every single room that we went in. And basically, it's just something that the family can fill out, or if the patient is able to, the patient can fill out. And on this side, it says getting to know you better, and just a little bit of why the hospital wants to know about the patient. And then here it says My Story. So first we start with please call me by, and then they can list the name that they would be like to be called by, a way to make this more personalized. Then it asks for things that the patient might want the nurse or other doctors or other medical staff to know about them. Then it asks about who their loved ones include, their pets, their job or career, and all of this is in first person. So it's saying like, my name is Francie. I would like you to know that I go to Azusa Pacific University and that I'm studying nursing. My loved ones include my 2 brothers, my sister, and my parents. So it's just a way for the nurse to really get to know the patient on a different level. And in the ICU, that's very important because there are so many barriers when they come in there, because they're so physically sick that I think a lot of times the attention is taken away from the patient as a whole and focus more on their physical needs and what we can do for them right there and right now. One thing that is specific about this board is that we want to know their spiritual needs, because through research, time and time again, I found that spirituality is a very important part of taking care of a patient, and I think we all understand that. Florence Nightingale was one of the first nurses known for being a holistic care nurse, and I'm going to go into a little bit of research about that with the American Holistic Nursing Association. So holistic nursing, as we know today, is widely accepted, and it was started long ago. Linda Thornton of the American Holistic Nursing Association says, quote, that Florence Nightingale was believed in care that focused on unity, wellness, and the interrelationship of human beings and their environment. She is considered to be one of the first holistic nurses. Taking care of our patients and providing a conducive environment is very important. So the intensive care unit may help facilitate a better physical status, but it comes with many barriers for the other psychosocial and spiritual statuses of a patient. A patient in the ICU is on a lot of monitors. Doctor's orders are being called in. The nurse is taking a report from the ER, the OR, and there's a lot of time for the families. There's not a lot of time for the families to express their needs or the patient to express their needs up front because of everything that's going on. An article in the Dimension of Critical Care Nursing was published on spirituality, and in this article, Carpenter, Gervin, Kittner and Ruth Sahad discuss the importance of patient spirituality and the barriers in the ICU setting as well. They identified barriers such as noise, rapid nature of treatment, unconsciousness or comatose patients, doctor interruptions, rounds, and patients in and out of the unit, among with various other barriers. But family members are probably one of the key parts of nursing in the ICU, because with all these barriers, it's really hard to talk and to communicate with the patient. So we rely on the family members. And I know that a lot of ICU nurses have expressed that. So family members are often present on admission and throughout the care process. The nurse is not always able to get information from the patient, and so we need to go to the family members about this. And admission records, as helpful as they are in getting kind of an overall view of who the patient is, they don't always go as in depth as the nurse would need in order to provide the most beneficial holistic care to the patients. But families struggle with the feelings of restricted and their ability to take care of the patient. So not when the families come to us, we are going to them for information, but they're also coming to us because they don't always feel like they can do very much for their patient or their family member, because they're so sick. And, at that point, they're in a crisis situation, and we need to get them stable and enough to move them to a floor so they're not walking around as they would be in another unit, and the family members aren't able to help as much as they would be on a normal floor. In 2002, a study was done by Linda Ying-King Lee and Yi Ling Law on the immediate needs of the adult family members and the adult intensive care patients. These studies highlighted the ICU nurses were in ideal position to help the family members in fulfilling their needs. The majority of the studies were conducted in the USA, Canada, Australia, and one was in Hong Kong. This study was done to assess the needs of the family members of the patients in the ICU setting, and the research results found that they can contribute to stimulating awareness and discussing among ICU nurses on perception of family needs so that holistic care can be provided for them. There were 40 subjects in this study, and there was a 100% response rate. The study took place after 24 hours after the patients had been admitted, so they gave the family a little bit of time. And then what they did was they gave them a questionnaire. They started with a 45-question questionnaire, and then some of the studies reduced it to 30 questions because they felt like 45 was too much. And among honesty from the medical staff and the need for quality time with the patient, one of the top 10 most important needs found in this study was the need to feel that the hospital personnel cared about the patient. And the reason that we're talking about this now is because the My Story board is a way for the nurses and the doctors and the CNAs to really get to know the patient and to express their concern for the patient's well-being at hand, for their holistic approach, and so that we can address many of the patient's needs and not just their physical needs. So far we've discussed the needs for holistic care, the barriers that the ICU setting has in providing holistic care, and how the My Story board can really help facilitate better patient communication, better family communication, better nurse communication, and overall just the medical team taking care of the patient on a holistic status. So when implementing the My Story board and the change of this, I decided to use Diffusion of Innovations by Everett Rogers, which was created in 1995. And the reason I decided to use this was because what it's doing is, instead of making a new plan or new idea, it's taking an old idea, so the admissions record, which we're already getting a lot of information from about the family, their family composition, where the patient works, their social status right now. It's kind of giving us a brief overview of the patient, but not really an in-depth look at the patient. And so the My Story board is facilitating better holistic care because we're looking more in depth to the patient. We're allowing the family to give us more information on the patient as well, so the My Story board is also facilitating better family nurse communication, and just an easier way overall for the nurse to communicate with family members. But there's a 5-step process when you're using the diffusion of innovations theory. And first is knowledge. So during the knowledge process, the person becomes aware of the innovation and has some idea of how it functions. So in this step, I would introduce the My Story board to the nurses on the ICU unit and kind of tell them a little bit about how it would work, that it would be put up in the patient's room, and that the family member or the patient would be the person filling this out. The next is persuasion. The person forms a favorable or unfavorable attitude toward the innovation. So during this phase, it's very important that when the nurses are deciding if they like or if they dislike the My Story board idea, so it's really important for me as a presenter to show the reasons why this is important in the ICU setting, and to show the barriers that ICU nurses and family members and patients face, and how the My Story board can help them. The next is the decision phase. In this phase, the person engages in activities that lead to a choice to adapt or reject the innovation. So this is when we give them the My Story board, and they're going to take it on their unit. So they can either decide to use the My Story board on the unit and see that if it really works, or they might decide not to and kind of already go in with a negative feeling towards that. And the next is implementation. So the person puts the innovation into use. So same step, they're doing the decision and the implementation. So they're deciding if they're going to, and then they're actually implementing it. And then confirmation. And during this, the person evaluates if they liked the My Story board and the idea of it, or if they thought that it wasn't useful. And so I'm hoping that at City of Hope, when and if this does get implemented there, that they would see that when they use the My Story board, it helped them establish a relationship with the family members or with the patient, and they were able to provide better care for the patient. So I hope that you've been able to kind of follow a little bit along. I know you guys are in class, but so the idea of this My Story board is to just create a better patient interaction, a better nurse interaction, a better family interaction in the ICU environment, because there are so many barriers. And this My Story board is just a really simple way for the nurses to express their care for the patient. And it's really easy if you have a hard time communicating with family members. I don't usually, because I talk all the time, but it's just a way to ask the family members, hey, do you mind filling this out? I just want to know a little bit more about your family member, and maybe a little bit about their hobbies, what they like doing, are they a student? And instead of seeing that patient as just a person in the bed that I'm trying to get better, just really looking them on a different level, that they're a teacher, or they're a student, or they're a banker, or they love to golf, and just kind of connecting with them on a different level. I really liked this idea because these posters are only $1 a poster, and you can order them online. So if you go through a print shop online, it's $1 a poster. So for 250 posters, you could get it mailed to you for $250. It's already made. All I would have to do is scan this in, and so the City of Hope could use this same format, and just simple as that, scan it in, have it printed and sent to them, and it could be implemented onto their ICU unit as soon as possible. The one hard thing I think is changing something that nurses are so used to. You know, it's not something that you see in every ICU, and so there might be a little bit of hesitancy with the nursing staff that are there, as some seasoned nurses that have been doing this for years that might think that this is a ridiculous idea. But I think it's really simple. It's something that also the CNAs could be a part of, so that the nurse could delegate this if they didn't feel like they needed to talk with the family members and try to facilitate a better relationship. They could ask the CNA to maybe hand this to a family member, and just hang it on the wall. And even the doctors and PT and OT, everyone can come and look at this and just see the patient on a different level than just the person laying in the bed that we need to get better. So I hope you guys understood everything about this project, and I hope you have fun with your science fair. See you later.